Today, we're diving into one of the biggest public health fights of our time, India's war on cervical cancer. And you know, as the title suggests, this is a story that starts with a pretty grim reality, but it's quickly turning into a real blueprint for hope.
To really get your head around the scale of this, let's start with a single stark number. 1 woman.
And then, let's add a timeline to that. Every 8 minutes.
When you put it all together, the picture is just staggering. 1 woman is lost to cervical cancer every 8 minutes in India. But here's the part that changes everything, the most important piece of this whole story. This is a preventable cancer. This isn't some tragedy we just have to live with, it's a problem we actually have the tools to solve.
So, that leads to the big question, right? How do you even begin to fight a silent killer on a national scale? A problem this huge? Well, it's going to need a solution that's just as massive and just as smart. So let's break down how India is taking on this exact challenge.
Okay, so first things first. To really understand the fight, you have to understand the opponent. Let's take a closer look at what makes this a silent crisis in India.
So what exactly are we talking about here? Cervical cancer. It starts in the cervix. And the science on this is crystal clear. Pretty much all cases, we're talking over 95%, are caused by a persistent infection with high-risk types of the human papillomavirus, or HPV. And the thing is, HPV is an incredibly common virus. So, if it's preventable, why is it so deadly in India? Well, this slide really gets to the heart of it. It's not just a medical problem. It's deeply tangled up in social and logistical challenges. Too often, cases are caught way too late. Why? Because there's limited awareness, a natural hesitation to talk about reproductive health, and a huge gap in getting access to screening, especially for women in rural and remote parts of the country. So that's the problem. But now, let's flip to the solution, which is nothing short of a massive 10 crore woman fight back. And by the way, if you don't know, a crore is 10 million. So yeah, we're talking about a 10 million person effort. It's huge. And this is the headline number from that fight back, 10.18 crore. That is a monumental figure, and it's a direct answer to those grim statistics we started with.
And that number isn't just a statistic. It represents real people and real action. Over 100 million women, all in that high-risk age group of 30 to 65, have been screened. And this was all done through a coordinated nationwide push under the government's National Health Mission. So how on earth did they pull that off? Well, it comes down to this really smart, yet simple, 3-step model. It all starts at the grassroots level with community health workers. They're called ASHA workers, and they are the absolute backbone of rural healthcare. They're the boots on the ground, identifying women who are at risk. Then, a simple visual test is done right there at local health centers. And finally, and this is so important, if there's a positive result, that woman is immediately referred to a more advanced center for proper diagnosis and care. It's a system built to be effective and scalable across a huge country.
And look, this isn't just theory or numbers on a spreadsheet. This is real. Here we've got an official circular from AIIMS. That's the All India Institute of Medical Sciences, one of the country's absolute top medical institutions, announcing free screening camps. This shows you the deep institutional commitment that's making those massive numbers possible.
Okay, so getting to millions of women is one huge piece of the puzzle. But what if you could also completely revolutionize the tools you're using to screen them? That's what we're talking about next, reinventing the test itself.
For decades, the go-to methods have been the pap smear and lab-based HPV tests. And look, they work, but they've got some major downsides. They can be expensive, the results can take days or even weeks, and they need sophisticated lab setups that just don't exist in every town and village.
And this is where the story gets truly incredible. Just look at this comparison. Traditional tests can set you back thousands of rupees. But now, doctors at AIIMS have developed a new rapid kit that costs less than 100 rupees and gives you results in about 2 hours. I mean, just think about what that means for a woman in a remote village. An affordable test, an accessible test, and an answer on the very same day. And they didn't stop there. They've also developed a blood test, not just for screening, but to track if treatment is actually working and to catch a relapse early. This isn't just a small step forward. This is a complete game changer.
And get this, it goes beyond just finding the cancer in the first place. As Dr. Mayank Singh from AIIMS points out, this new blood test can spot if a cancer is coming back much sooner than a physical scan might. That early warning is absolutely critical. It gives patients a vital head start on the next round of treatment, and that can literally save their life.
For all you science lovers out there, the idea behind this is just so elegant.
The test uses a super-sensitive technique to find tiny fragments of the HPV virus's DNA that's been shed by the tumor and is just floating around in the blood. So, if the treatment is working, those DNA levels drop. If they start to creep back up, it's an early warning sign that the cancer might be returning. It's a brilliant, non-invasive way to keep tabs on the disease.
So, we've got the huge screening effort, we've got this amazing new tech, but there's one more crucial piece to this puzzle, and that's making sure we have a safe and regulated future for cancer detection. Because you have to think, right? Whenever you have powerful new tools, especially stuff using artificial intelligence, you have to ask the big questions. How do we know it's safe? How do we know it actually works as promised?
Well, India is already on it. The government has really stepped up here. You can see that AI software for diagnosing cancer isn't the Wild West anymore. It's now officially classified as a moderate to high-risk medical device. That means any company making this stuff has to go through rigorous safety checks and get official approval before it ever reaches a patient. This is exactly the kind of smart, proactive regulation you want to see.
Which brings us full circle, but with a totally new outlook. We've seen India's three-pronged attack: massive grassroots screening, radical low-cost tech, and smart, forward-thinking regulation. So the question isn't just, how do we fight this anymore? The question is becoming, how soon can we win? With this blueprint in place, the ultimate goal, to actually eliminate this preventable killer, well, it finally seems within our grasp.